Welcome back and good morning, my dear medical students. In my last lecture, I was talking about the spinal nerves. There are 31 pairs of spinal nerves, and each spinal nerve is having a ventral and a dorsal root, and each root is having thousands of rootlets. Hopefully, you all know there is a dorsal horn which is pure sensory and ventral horn which is pure motor in spinal cord. Very straightforward arrangement of the columns of the sensory and motor rootlets of the spinal nerves. So as I have talked in my last lecture, each spinal nerve is having a dorsal root which is having the central process of the pseudo unipolar neurons of the dorsal root ganglion. There are thousands of rootlets in the ventral and dorsal roots of the spinal nerves, and the efferent outflow or motor firing of the spinal nerve is from this ventral root, which is also having thousands of rootlets coming from the alpha and gamma neurons of the ventral horn. Here is sympathetic trunk and sympathetic ganglion, which is having postganglionic fibers for the sympathetic outflow. Here is the trunk of the spinal nerve, which is having a dorsal and ventral roots which unite to form the spinal nerve, which exit from the intervertebral foramina of the vertebral column, and the fibers which are coming from this intermediolateral column of gray matter, fibers which are coming from this intermediolateral part of gray matter will enter in the sympathetic ganglion, and after synapses the postganglionic fibers will re-enter in the spinal nerve. The fibers which are entering in the sympathetic ganglion known as white ramus, and these are myelinated fibers, and fibers exiting from the sympathetic ganglion are non-myelinated and known as white ramus. These fibers which are postganglionic, non-myelinated, will supply the viscera of the abdomen, heart, smooth muscles of the blood vessels and glands, and fibers which are coming from the alpha and gamma neurons, big neurons, will enter in ventral ramus. This is ramus, ventral ramus, and this is dorsal ramus. Rami are having the mixed fibers of sensory and motor neurons. These fibers will supply the skeletal muscles, and this dorsal ramus is having fibers which innervate the skin of the dorsum, and fibers which are somatic efferent will supply the muscles of the back. This ventral ramus of all spinal nerves will supply the trunk, anterior lateral part of the trunk, upper limbs and lower limbs. To innervate the upper limbs and lower limbs, the ventral rami of the thoracic and lower cervical and thoracic and the lumbosacral region will form plexus known as brachial plexus and lumbosacral plexus for lower limb and pelvis. So, spinal cord is having 31 pairs of the spinal nerves and segmental innervation. There are 31 segments. Lowermost segments fuse in adult, and nerve fibers coming from lowermost part will form cauda equina like this. The lowermost part of the spinal cord, which is tapering part, known as conus medullaris, and here is foramen magnum, and uppermost part, which is uppermost continuation of the spinal cord, is known as medulla oblongata. There are three distinguishing boundaries between the spinal cord and medulla. One is foramen magnum, other is motor root of the C1 spinal nerve, and third is pyramidal decussation. Pyramidal decussation. One more thing I want to mention here. The first cervical nerve, that is first spinal nerve, and the nerve which is originating from the coccygeal. The first cervical and coccygeal spinal nerve is having only one root, that is motor root. So, C1 nerve and coccygeal nerve are not having the sensory root. So, there are 29 sensory roots and 31 motor roots in the spinal nerves. One more thing, there are some functional components in the spinal cord which innervate the upper limbs and lower limbs and trunk. These are there are four types of functional components. Four functional components. These all are general components and innervating the parts of body which are having general modalities. So the dorsal horn, which is sensory, bringing the senses of different parts of upper limbs, lower limbs and trunk. These senses which are coming through the dorsal root ganglion in the dorsal horn of the spinal cord are having two functional components. I want to mention again the section of the neural tube. Neural tube is having three layers. Innermost layer is ependymal layer, which is having ciliated columnar, low columnar or ciliated cuboidal cells. This is the most primitive zone of the neural tube, which is having a central canal which eventually form the ventricular system of the brain and central canal of the spinal cord, and this is innermost layer of the neural tube. The cells of this zone known as ependymal zone will divide and form neuroblasts and spongioblasts. Neuroblasts will give origin to the neurons or nerve cells, and spongioblasts will form the glial cells, that is oligodendrocytes and astrocytes, and one more zone will be formed outside the ependymal zone, and this zone is mental zone, and this is having the neurons or the grey matter of the spinal cord and the brain. The outermost zone is marginal zone, and it is having the axons which are myelinated and known as white matter. The axons which are coming from the dorsal root ganglion are from the neurons, pseudo-unipolar neurons of the dorsal root ganglion, develop from the neural crest cells, and axons which are leaving this ventral horn through this motor root, develop from this mental zone of the neural tube. So here are four vertical columns formed in the neural tube, and spinal cord is primitive part of the central nervous system, which maintain this straightforward approach of the segmental and vertical arrangement of this grey matter. So here are four functional columns in a spinal nerve. These are sensory and these are motor, but all are general. This nuclei or functional component which develop from LR lamina is general somatic afferent, and these outermost neurons, axons bringing the sense are general somatic afferent. These fibers are bringing the senses of touch, pain, temperature, 2-point discrimination, vibration from the dorsum and ventral part of the trunk, upper and lower limb. Then the fibers bringing the sensation from this heart, viscera, blood vessels and glands are general, visceral, afferent. These are bringing the sensation of from chemoreceptors and from the inner part of the blood vessels, from glands, and stretch and pain sensation from this viscera are general, visceral, afferent. So both columns which are in the dorsum are general, somatic, afferent. Somatic means body wall, and general, visceral, afferent. Viscera means the part which develop from the side of yolk sac or inner part of the body. And this ventral horn is having the general, somatic, efferent. The fibers which are supplying the skeletal muscles, these fibers which are coming from this ventral horn of the grey matter and bringing the neurons for skeletal muscles, and these fibers will supply the extraphysial and intraphysial fibers of the muscles, skeletal muscles. These are general, somatic, efferent. The fibers which are coming from intermediolateral column of the spinal cord and enter in the sympathetic ganglion in the form of white ramus or white rami communicant entering in the sympathetic ganglion, and after making synapses in the ganglion, postganglionic fibers arising from the sympathetic ganglion will supply this heart, lungs, blood vessels, glands, and viscera of the abdomen. These fibers are known as general, visceral, efferent. So there are 4 basic senses which can be seen in whole body. These are touch, pain, temperature, and pressure. So 4 senses: touch, pain, temperature, and pressure. These are general senses because all 4 senses can be received from all parts of the body, including the uppermost part, that is head, neck, trunk, upper limbs, and lower limbs. But there are some senses which can't be received in the whole body, like vision, hearing, olfaction, taste, and balance. These are seen in only head and neck region, and these special senses make the concept of cranial nerves. There are 13 pairs of cranial nerves, but one cranial nerve which is adjacent to the olfactory part or first cranial nerve, that is olfactory cranial nerves, it is not considered as a cranial nerve. It is having some special fibers for some sex hormones. So in head and neck region, there are 12 pairs of cranial nerves. The spinal nerve is having mixed fibers of the sensory and motor root and form the trunk and then anterior and posterior ramus. On the other hand, the cranial nerves are having either sensory or motor or mixed fiber of sensory and motor neurons. So cranial nerves are either sensory or motor. On other hand, spinal nerve is a mixed nerve. So how a spinal nerve differ from a cranial nerve? The cranial nerves are having their nuclei in the brain. First, second cranial nerves are having their nuclei in the prosencephalon. Here I will draw the brain to show the attachments of the cranial nerves. Here is prosencephalon, that is telencephalon, cerebrum, and diencephalon, that is thalamus, hypothalamus, epithalamus, metathalamus, and subthalamus. And here is well developed ventricular system. Here is midbrain, mesencephalon, pons, part of rhombencephalon, known as metencephalon, which also form the cerebellum. Here is bulbar or bulb-shaped medulla oblongata, and lower cylindrical part is spinal cord. So this is the central nervous system having a well developed ventricular system, two lateral ventricles, and the third ventricle between the two thalami, and the cerebral aqueduct of Sylvius in the midbrain, and the fourth ventricle flowed by the pons and upper open part of the medulla, and roofed by the tectum, that is that is the cerebellum, and it will remain continue with the central canal of the lower closed part of the medulla and the canal of the spinal cord. Now there is 12 pairs of cranial nerves. First, olfactory, which is having 15 to 25 rootlets and having olfactory bulb and olfactory tract. So first is olfactory cranial nerve. The second cranial nerve, first and second cranial nerves are not true cranial nerves, or on other hand I can say this is continuation of or projection of the prosencephalon, known as olfactory nerve, and second cranial nerve, which is continuation of the diencephalon, that is continuation of diencephalon, and this nerve is known as optic nerve. Diseases of the myelin sheath of central nervous system, known as multiple sclerosis, also affect this optic nerve, while all other nerves are injured in the diseases of peripheral nervous system like acute inflammatory demyelinating neuropathy or Guillain-Barré syndrome. But optic nerve is involved in multiple sclerosis because it is myelinated by oligodendrocytes, and other nerves are myelinated by the Schwann cells. So first nerve olfactory, second optic nerve are having their nuclei or termination in the prosencephalon, that is olfactory in telencephalon, and optic nerve in diencephalon or the thalami, and all cranial nerves remaining 10 cranial nerves are having their nuclei in the brainstem. The midbrain, that is mesencephalon, and hindbrain, part of metencephalon pons and myelencephalon, which form the medulla, collectively known as brainstem. This part is known as brainstem, one of the most complicated part of the central nervous system. And here is midbrain, pons, and bulb shaped medulla. This is pontomedullary junction, and here is anterior median sulcus, which is continuing with the anterior median sulcus of this spinal cord, anterior median fissure of the spinal cord, and here is pyramid, which is formed by bulging of the pyramidal tracts, and here is part of inferior olivatory or olivary complex nucleus known as olive, and here are connections with the cerebellum known as inferior cerebellar peduncle. Here is inferior cerebellar peduncle. In same way, pons is connected to the cerebellum by middle cerebellar peduncle, and midbrain is continue with cerebellum through the superior cerebellar peduncles. Here is interpeduncular fossa, and this is, here are thalami too. So this is the diagram of the brainstem. Now, how the last 10 cranial nerves are attached to the brainstems, and what are the sites of the exit or entrance in the brainstem. So there are 12 cranial nerves. First is olfactory, second is optic, third is oculomotor, fourth is trochlear, because it innervates the fourth. This fourth nerve is nerve of the superior oblique, which winds round the trochlea of this upper part of the eye. Fifth is trigeminal. It is better to use the Roman to indicate the cranial nerves. First, second, here is third, fourth, and fifth. So first two cranial nerves are attached to the prosencephalon, that is olfactory and optic. Now third cranial nerves exit from this interpeduncular fossa, this is the oculomotor nerve, and fourth nerve, only cranial nerve. Only cranial nerve exit from this dorsum of the brain, because it is having some primitive relations with the pineal gland or pineal body, which is also known as the third eye. So, nerve is taking origin from the dorsum of the midbrain, winds around the midbrain and emerges on the anterior surface. The fifth cranial nerve is trigeminal nerve, having attachment from the sensory and a motor nuclei. Medial is motor and lateral is sensory nuclei of the trigeminal nerve. Fifth nerve is trigeminal nerve, attached on the middle of the anterolateral or ventrolateral part of the pons. This is pontomedullary junction. The sixth cranial nerve is abducent. The seventh is facial, and the eighth is vestibulocochlear nerve. These all three cranial nerves, sixth abducent, seventh is facial, and eighth is vestibulocochlear nerve. All three nerves emerge from the pontomedullary junction, that is the junction of the pons and medulla. So, medialmost abducent, then middle one is facial, which is also having a motor and sensory nuclei in the lower part of the pons, and this lateralmost nerve in the pontomedullary junction is vestibulocochlear nerve, which is having a vestibular part which is attached to the vestibular nuclear complex, which is having a upper, that is superior, inferior, medial and lateral 4 nuclei, and it is having a cochlear part which is attached to the ventral and dorsal cochlear nuclei. Here is 6th, 7th and 8th cranial nerves. Here is a big 5th cranial nerve which is having trigeminis, that is trigeminal. This is 3rd, and this is 4th cranial nerve, that is trochlear nerve. And as we have seen already, the 1st cranial nerve, optic, the 2nd cranial nerve. This is junction of this pyramid and olive, that is pyramidal decussation bulbs formed